I'm going to show you how to do a saline flush on a saline lock. We first will want to verify the order on the medication record, and we want to make sure that we have an order for this normal saline flush. So this is considered a medication, so we want to do our 3 checks, and we also want to verify our patient prior to administering it. We have the pre-filled 10 milliliter syringes. The orders are typically for a flush of 3 milliliters, and these are a one-time use syringe. So after you inject the patient with the 3 milliliters, the other remaining portion is discarded in the sharps container. So we verified our patient, verified our medication, we've done all of our checks, our hand hygiene, and now we're going to come to the room come to the site to inject the saline. What we're doing here is first we're going to inspect the site, looking for any redness, any swelling, any signs of infection or infiltration. I'm going to then open up my saline and prepare my site. So I'm going to use an alcohol swab. I want to scrub the hub for 15 seconds. Okay. And now I'm going to take off my sterile cap. And on these syringes, there is a suction on here, or a seal on there, so you can't really push up on this plunger. So if you see here, I'm trying to push the plunger, I'm not getting anything out. So we need to actually break this seal. And you're going to pull back on this plunger, and you should hear the pop of it. Okay, so now the seal has been broken. I have a little bit of air up here that I want to remove, so I'm going to slowly remove the air until I see the saline hit the top of my syringe. And now I'm ready to connect it to my saline lock. At this point, this is a needleless system, so I'm going to push in and twist. I'm then going to unclamp my J-loop, and I'm going to prepare to insert 3 milliliters of normal saline. As I'm inserting the saline, I want to watch the insertion site. I also want to aspirate and make sure that I have any blood prior to inserting. So I've connected it, I've opened up my clamp, and now I want to aspirate back, and I'm looking for a blood return. If I don't see a blood return, basically the blood return is to show that you are in the vein. If I don't see a blood return, it doesn't necessarily mean you're not in a vein. It might be that you're up against a valve in that vein, so you're not getting the return. So at that point, you would slowly start to inject the normal saline, and as you're injecting, you are watching for infiltration. You're also asking the patient if there's any pain at the insertion site. And we're doing this again for 3 milliliters. Slowly injecting the saline. The saline is slightly cold. It's typically at room temperature, and the patient does sometimes complain of a little burning because of the coldness. So once you've done the 3 milliliters, we would clamp off our J-loop and remove the syringe. Again, we can inspect the site, making sure that there's no redness or infiltration. We would then document in our medication record that we administered the saline and discard of all of our materials. The alcohol swabs are a one-time use as well, so please do not reuse the alcohol swabs to re-swab off your hub or anything. You would want to just get yourself another alcohol swab. And that's how you do a saline flush.